So thank you for inviting me today. I'm going to be starting the presentation and talking about SCHOLAR, our new component to the curriculum, and then I'm going to be followed by Christina Wyatt, who's going to be talking, as I'll tell you, about another aspect of the program. So SCHOLAR, with little a, stands for Scholarship and Research. And as I mentioned, it's a new scholarly component to the curriculum. And the reason we called it SCHOLAR with a little a is that we want all our students to know that the type of scholarship we embrace is more than that, that's done in a laboratory. And I'll elaborate a little bit on this. And neither of us have any disclosures. So what is SCHOLAR? It's an extension of the existing scholarly programs in which we attempt to foster excellence in scholarship in our medical students by helping them learn how to apply the scientific method to medicine. We want to encourage their creativity as well as give them a choice on what they would like to work on. We would like to help them develop their ability as students and as future clinicians to advance science and medicine as well as advocacy by understanding the role of scholarship in that process. The SCHOLAR program consists of two arms. One is a longitudinal arm in which the students receive support to develop and carry out a scholarly project. In addition, there are didactic sessions held during the in-focus intersession, which are directed at principles, teaching the students principles underlying how to carry out rigorous research and understand the principles of evidence-based medicine. So I'm going to talk about the first arm, the longitudinal aspect of SCHOLAR, and Christine is going to talk about the didactic sessions. So one thing that's very exciting to several of us who've been working with medical student scholarship for several years is that starting with this class, the class of 2017, all students graduating from the Icahn School of Medicine will be required to submit a scholarly product as a graduation requirement. And this must be the basis based on a project started after they began medical school. Now, this is a pretty high bar, and we want our students to succeed. We want them to enjoy what they're doing. We want them to learn through the process, and therefore SCHOLAR was developed in order to offer them additional support beyond that what was previously available for students who chose to do a project so that they can do a rigorous project. It was always our attempt that students do high-quality, rigorous research, but with the resources available, there were always a few situations in which students' projects didn't work out as planned, and while that may be true for research in general, we want to try and enhance all students' experiences. So it may seem obvious, but if this is a requirement, we have to define what is a scholarly project, and so it is what we consider either a conventional research, or, importantly, other type of project that addresses an issue of importance to an aspect of medicine. It can be in one of several tracks, and I'm going to tell you about the tracks shortly. Now, traditionally, when we're thinking of research, the process involves posing a hypothesis, developing a research plan to test this hypothesis, carrying out this research plan, gathering the data, analyzing the data, and coming up with an interpretation of the results and conclusions. However, given the broad focus of SCHOLAR and the fact that we want to embrace various types of scholarship, this method this model may not apply to all the tracks. So what are these tracks? They are overlapping, and the purpose of the tracks is really more to help direct the students, help them see what we consider worthy of their time and where they can obtain support. So there's what I call basic translational research, traditional laboratory research, clinical translational, or, for example, epidemiology research. And clinical translational is an area that bridges basic research and clinical research. For example, it can be lab-based, but it's something that involves patients' material, patient samples. Health evidence and policy, medical education research, global health scholarship, community service scholarship, innovation and discovery, medical humanities, and excitingly, we have recently started to discuss the possibility of having a human rights and social justice track. And I'm really delighted that Dr. Atkinson and Selena are here, with whom we'll be working on this. So what type of support do we have for students? The main support will be the Medical Student Research Office, and that consists of myself, Christina, and Alicia Williams. I'd like to introduce Alicia for those of you that don't know her, and she's fairly new, but I'm going to stop saying that soon because you're really part of the family now, and is the coordinator for the SCHOLAR program. Each student also has a track advisor. I'm going to define and tell you what that is because that's a new role, and a primary mentor. The projects that students develop are going to be reviewed by a committee to ensure that what the students propose is likely to fulfill the graduation requirement. And actually, I'll tell you that this is the first year of SCHOLAR, the beginning of the second semester, and we've regarded it as, in part, a pilot program, and we are still tweaking. We're identifying areas of strengths and areas in which we think we could offer more support or improve the program. And that's one of the reasons I'm delighted that Christina and I can talk to you today, so we can get feedback from people here in order to make the program better for our students. So what is a track advisor? Track advisor is a faculty member who, him or herself, is involved in scholarly work and has a history of successfully mentoring students. It's another layer of support for students. They are what we call objective observers. They're student advocates and are not directly involved in the scholarly project. The TA, track advisor, helps the student vet the possible projects that they're considering to do to see not only which is the best fit, but which promises to be the most successful. Sometimes when you're too close to a project, as a mentor may be, you're very involved in the project. You're not thinking so much about the student's timetable. You're not really aware of the student's other commitments, and may suggest something that is less feasible than ideal. The track advisor, again, who is not a content expert, but looks at this objectively, is something who can point out to beginning students, first-year students, things they maybe should go back and discuss with their mentor. And we're delighted at the track advisors that we have, and I'd like to introduce them to you, at least virtually. So Steve Itzkowitz, many of you know, he's very involved in medical education, is somebody who can wear many hats because he does basic research, he does clinical research, he does translational research, and so he can help students in any of these three tracks. The person who is primarily responsible for students doing clinical translational research is Eliza Zier. Eliza is a graduate of the Mount Sinai, the Icahn School of Medicine, when it was still Mount Sinai School of Medicine, and she is an endocrinologist. Perry Sheffield is responsible for overseeing the clinical research track. Liz Howell is responsible for health evidence and policy. Pete and Rena, of course, are the ones who are the track advisors for medical education, something they've successfully been doing for many years. Renee Bischoff and Susie Bentley are the track advisors for global health scholarship. Yasmia and Angel Palermo are in charge of community service scholarship. Scott Friedman has been the go-to person for the innovation and discovery track. That's another track that's now under development and expansion. And Suzanne Garfinkel has been responsible for the medical humanities track. So what do we look for when a student submits an abstract for a project? None of the track advisors are looking for, frankly, whether we find it personally interesting. That's, of course, not important. What we really want to know is that if the student is interested in doing this project, is it feasible? To me, that's kind of number one. We assume it's interesting to the student, although sometimes student needs a little help. They may be settling on a project because they're not sure and they're confused, and this is one of the things that Christina or I or the track advisor can help with. In most cases, research projects have traditionally been novel. You don't want to recreate the wheel and do something again. However, novelty, as it's customarily defined, may not be appropriate for all projects. For example, certain global health projects where you are doing a project that's been done in one country, but you're taking it to another setting. It may not be novel in the traditional definition of the term, but it's important to introduce it to a new setting and see if whatever the results are the same with a different population or in a different environment. Of course, all projects must be ethical, and they should be relevant to some important question in medicine. And if anybody has any comments or any questions or would like to contribute something or ask, please. We're very informal, of course.
Well, for instance,
yeah.
would you expect they have the IRB approval?
Pardon me?
IRB approval?
Everything has to be IRB approved, yes. You're going to see this in terms of the milestones.
So it starts out very early.
It starts out very early, yes. Yes. So what kind of a scholarly product as a graduation requirement have we set? And I think we're starting slowly. We want our students to succeed. My personal philosophy is you can always raise the bar, but since we are still learning about this process and the track advisors are still learning about the process and we're tweaking the program, what we've said is something that we think is very doable. A first author abstract approved by the mentor and track advisor for Medical Student Research Day. Now, the asterisk reminds me to mention to you that actually this is something that we're considering. What are the guidelines? What are the criteria? How are we going to determine that something is an acceptable scholarly product? And this is something we're actively working on. And the student also has to present the project as a poster or an oral talk if they're selected for that at Medical Student Research Day. And this can be done during any of the students' 4 years here at Icahn. Students, although that's fulfilling the graduation requirements, students will also know they can qualify for research honors in the form of distinction and research. It is necessary but not sufficient to present their work at Research Day. However, in order to qualify for research honors, they would submit this work to an outside scientific meeting and for publication in a peer-reviewed journal. So the criteria for distinction in research is publication of a first author paper in a peer-reviewed journal or submission of something in a manuscript form of which the student is first author that's reviewed by an ad hoc committee. We're going to keep that. So how do they get started? Students come in as first years. They need a lot of support. Every student other than MSTPs and students in the MD, MPH program are required to meet with either Christina or me. And we try to understand, to start a dialogue on what their interests are, and then to select potential mentors. At that time, we also assign a track advisor. Now, as you've seen, there's a lot of overlap in the tracks. I mean, something that's clinical research can also be health evidence and policy. And again, these are not, so that just tells you there's a lot of flexibility. Sometimes it's who do we think would be the most appropriate track advisor to the student. Sometimes it's just to actually equalize the number of students in the particular track so that no track advisor is overburdened. So we built in flexibility for that. It is then the student's responsibility to reach out to the potential mentors whose names we have given them and to see if there's some kind of fit. We encourage them to go to PubMed to see what this individual has been publishing so that they get a better idea than we can provide on what the faculty person's research interest is, to talk to other students, maybe to talk to other faculty members, and after that, to meet with the track advisor. How are students going to be able to do this? When are they going to find time? Of course, it's challenging. We all know that. Most students will be working on a scholarly project during the summer after year one. And in fact, that in itself is not a change. We have, considering all the programs together, those offered by the Medical Student Research Office, Global Health, CMCA, MSTAR, well over 90% of first-year students do a project between year one and year two. One of the changes is now with the new curriculum, students have flex time, that is the afternoons, Tuesday afternoons. And they'll be able to work on their projects then, and also, as they traditionally have done, on weekends. There are other opportunities. Some students may avail themselves of a scholarly year. In fact, about 30% of our students do choose to do a scholarly year. Whether the Scholar program is going to increase this number or not remains to be seen. Students can do a tailor-made elective during years 3 and 4, a research elective. But we are cautioning them to keep in mind this is a graduation requirement, and we want them to fulfill the requirement as early as possible. And so, although I said earlier, the requirement can be fulfilled in any of the 4 years by presenting an approved first author abstract at Research Day, we are hoping and / anticipating that most students who do a summer project continue to work on this project during flex time in year 2 and present at Research Day will fulfill the graduation requirement with the support they are getting all along the way. Part of the support comes in form of milestones. So milestones were something that were developed by the curriculum design team led by Rena, of course, in order to help students know what their responsibilities are, to assess their progress to complete these responsibilities in order to make sure they're on track. And there are select scholar milestones so that students know what they have to do, when they have to do it, in order to be ready, to have a project and be ready to do it during the summer. This doesn't show up too well, sorry about that, but what you can see is I did bold the scholar milestones. So there are going to be some tweaks for next year going forward, but for the class of 2018. But essentially, so the students enter at the end of August, and by the end of October, they meet with Christina or me, again, to talk about their research interests and to get the names of potential mentors. They have about 4 or 5 weeks, and last year it was by the 2nd of December, to meet with potential mentors, discuss possible projects. Then by the 13th of December, that is right before the end of the fall semester, they met with their track advisor. So these milestones, again, are always by. So the students can do it as early as possible, but the latest date is by mid-December. They had to have met with their track advisor. By February 4th, they were required to submit the name of the mentor that they want, with whom they wanted to do their summer project. By February 14th, they met with their track advisor to get feedback on a draft of a summer research abstract. And we consider this very important because it is here where we can offer students additional support. Sometimes projects that we would get abstracts for Research Day, it was rare, but it did happen, where, for example, a student abstract dealt with a longitudinal clinical trial that required recruiting patients and had endpoints that were 2 years in the future. That's not the kind of project we want our student to do. We want them to have some degree of ownership and feel some degree of pride in what they're doing. So it is at that point the track advisor would say, whoa, reconsider and point out to the student what they don't realize, that what they can do during an 8-week period in such a project is little or even nothing. And so by March 3rd, they submitted a revised abstract, and this was this qualified them to receive a summer stipend. Submitting an abstract that was approved to work here for the summer was what they needed to do to apply for a summer stipend. And here, Dr. Case, you can see by April 1st, they were required to submit their IRB paperwork. And by April 21st, their FAFSA, which is their financial aid form. The reason we have required for years, we've required this of all students, is that we have a lot of students to fund. And we get a certain number of stipends from the feds in the form of work-study stipends. And we have to make sure that we use all of these stipends. First of all, we need it to support the students. But also, if you don't use these stipends, they reduce your award for the next year. Give it to somebody else who does need it. So these were the students' milestones. And just a little bit of data. So Christina and I met with a total of 126 students in the first year class. Required some fancy footwork, yes. MD PhDs, as I mentioned earlier, we did not meet with them. And although the MPHs weren't required to meet with us, some decided to. Why weren't they required? Because they have a thesis requirement. So we knew that they would be getting mentoring and support along the way. And there was another mechanism in place to help them. In terms of student track selection, you can see 19 students decided to work in what was called a basic translational project, 7 in a clinical translation, and there's overlap here too, of course, 61 in clinical research, and that's been the similar to what we've been seeing for several years now, kind of a 2-to-1 clinical to basic ratio. 1 student's working in innovation and discovery, 1 student in humanities and medicine, 6 in health evidence and policy, and 3 in community service scholarship. And one of the reasons that we're thinking about an HRSJ track is that within, there are students working on HRSJ projects, and they are spread out among several tracks. I mean, they could be working in clinical, they could be working in health evidence and policy. The 1 student in humanities and medicine is an HRSJ, could be community service scholarship. So my question to Selena and Dr. Atkinson was, would it be more helpful for your students to be grouped in their own track, or do you prefer to have the cross-pollination of having them in different tracks? And so this is something we're going to be discussing. The plans of the class of 2017, so 97 have applied for summer funding. 16, that is for summer funding from the MSRO, the Medical Student Research Office. 16 are being supported by Global Health. There are 12 MD PhDs, 8 MD MPHs. 7 students are not doing research here, and that's out of 140. And this year, again, for the first year, we were able to find out exactly what every student is doing because we don't have a 12-month curriculum. They were not required to tell us, but as part of a milestone, when they tell us they're not applying for funding, we want to make sure that they have some plan and they're not just saying, no, I don't think I'll do summer research here, and then 2 months later say, you know, I didn't really give it a lot of thought. I really do want to do that. So the numbers are not showing up, but they total 7. I think 1 or 2 are doing research at an institution near their home. 1 student just said, I just don't want to do it now. I'm going to do it later. 2 students applied to external programs because we do advertise national summer programs to our students. 1 has a military obligation. 1 student is an international student who has a visa issue, so she has to go home. She's going to try and do a project there. 1 student is going back to his old lab. And then, as I mentioned to you, there are the global health students. We are fortunate in that in addition to students supported by MSTAR and the Patricia Levinson Fellowship for Community-Based Research and Scholarship, 3 of our students have gotten external fellowships. Kamir Kidia got an AOA fellowship and he's being mentored by Craig Katz. Justin Keyes being mentored by Alex Kolivzin, and he has an American Academy of Child and Adolescent Psychiatry fellowship. And Sarah Abramson, working with Nina Backel, has a fellowship from the New York Academy of Medicine. It's a grant in urology. What are the challenges? Many. One thing to deal with is first-year students who are not sure of what they want to do or what field they want to work in. We reassure them nobody expects you to know as a first-year student what field you want to apply in, what you want to do for the rest of your life. We encourage them to pick a project they find interesting now, something that is rigorous that they would be interested in working on. And also that this is not their only project. They're going to have many opportunities to do other projects. Of course, students are busy and have limited time. We think the Milestones helps them to know what they should be doing when, so that they are more successful at identifying a mentor in a project, and that they will be more successful at completing that project. There are some issues, for example, with students who don't complete Milestones on time, especially the IRB. Sometimes they are, I mean, in this case, it has come down in some cases to the mentor who just says, I'm not ready to do it now, or it's being done by a fellow. So we're trying to think of ways in order to work on this for the student's sake, because again, there are usually 1 or 2 students out of the entire class, when it comes time to start, they don't have IRB approval, and then that student can't proceed with their project. And also, students need guidance to know whether we anticipate the project they select doing is one that will fulfill their scholarly requirement. And as I mentioned earlier, we are working to develop a process for this, to develop guidelines so that they know what's expected of them. So with that, any questions at this first half? Maybe I'll turn the microphone over to Christine, and then we can just have a general discussion.
Okay. So I'm going to talk about probably the more pure educational side of this, which is the didactic component of the SCHOLAR program. And the didactic sessions we decided to embed during In Focus. For anyone here who's not familiar with In Focus, these are week-long intersessions, what used to be called intersessions, that are focused on some fundamental topics that the students, we feel like students at Icahn School of Medicine should be exposed to, but may not be exposed to in other courses. So that's a variety of topics, including human rights and social justice, global health, health disparities, and in addition to that, skills, basic skills in research. So this course, as Karen mentioned before, is going to be just an introduction to some of the basic principles that underlie rigorous research, and also the bridge between research and evidence-based medicine. This course is largely weighted towards clinical research. Part of that is, as you can see, based on the decisions of most of our students to pursue research in that area. But we do try to incorporate examples from basic science research when they're relevant, and also just come back to the issues of developing a hypothesis, developing a research plan, issues that are relevant both to basic and clinical research. Importantly, I think, and just following closely on the challenges slide, I'll say that one of the issues that's been both fun and also a bit challenging is that we, because of this focus on clinical research, incorporated the material from the former epidemiology course. And I'll come back to this a little bit, but this is a course that has traditionally suffered, not just here, but at all medical schools, from the fact that students come in with an incredible breadth of knowledge. So most students come to medical school knowing absolutely nothing about anatomy, so they all start at the same space, the same place on the playing field. But a course like epidemiology is always challenging because there are students, certainly we exempt students who come in with an MPH, for example, but there are students who have taken advanced statistics courses in college. There are students who've had absolutely no exposure, and trying to teach to that broad base of students is a little bit of a challenge. So that's been one of the exciting parts of this, but also one of the challenges. Just quickly, since this is actually a course, just quickly to touch on the competencies that are addressed in this course. Competency 3 from the school is learning, scholarship, and collaboration, and this is really the primary competency that's addressed by the SCHOLAR program in general. So obviously this competency focuses on the idea that graduates should leave our school as inquisitive and reflective learners and practitioners who will think creatively and who will work effectively and collaboratively with others. So obviously this is a skill that's important. Collaboration is important in your clinical practice, but research is really a great opportunity to develop many of these skills. So we consider that SCHOLAR is an ideal forum to teach and evaluate this particular competency. The didactic sessions really focus on core competency 3B, which is methods of investigation, the quantitative piece of this, methods of investigation, analysis, and dissemination. But again, we do also touch on a number of the other competencies that are here. Some of the other competencies are also woven through competency 3F1, which is ethical principles of medical practice and research. We also address, although not in great detail, but we do address this during the course as well. And certainly professionalism is an issue, particularly with the milestones. I think that really learning how to take responsibility for your own work is an important thing that's taught through this program. We have tried to build the didactic portion so that it coordinates with the scholarly project as sort of a natural progression of the development of a scholarly project. So in Focus 1, which is in fall of year 1, really just sort of talks about the basics of study design. What types of research can you do? What study designs are there? And this is as students are identifying mentors, talking about potential project areas. So this is really, the difference between a cohort study, an observational study, and an experimental study, and really just giving students that basic information. In Focus 2, which is held towards late January, early February of year 1, which sort of is around the time that students are starting to really design and develop their research project for the summer with a mentor, is discussing fundamental concepts of hypothesis testing. So you've designed your study, this is what you want to do, how are you going to actually answer the questions that you've set out to answer? How are you going to analyze your data? And part of the reasons that we did this here is because that's obviously an important thing to think about in advance of doing a study. The thing that the students really, I think, can grasp the most is that this is an important time to figure out your sample size calculation. So you can't understand how to design a sample size calculation without understanding the way that you're going to analyze your data in the first place and without understanding the basic concepts of statistical analysis. And this is simple comparisons. This is how to do a t-test, how to do a chi-squared analysis, what those tests mean, why you would use them, what types of data you can analyze in that way. And finally, in Focus 3 and 4, which is in year 2, this is while students who've done summer research are completing and then beginning to present their summer research projects. These students are going to be exposed to more advanced concepts of hypothesis testing. So these are things that they might use in order to, or they may not be doing them themselves, but they're maybe working with a statistician who will use some of these concepts to analyze their data. But also I think is an important foundation for evidence-based medicine. And these are concepts like how do you do a survival analysis? What does that mean? What are the principles behind that? What is multivariable regression all about? Not how you do it, but what are the principles that underlie it? What are the assumptions? What kind of information can you put in and what can you expect to get out of a model like that? So this is really just the principles so that students won't look at this as a complete black box when they read an article. And again, in Focus 3 and 4, we're also going to start to incorporate concepts of evidence-based medicine. So the primary faculty member for this, I actually tried to bring up a grainy photo from the website, but it actually, as does mine, looks kind of like a mugshot and doesn't do Anita justice. But our primary faculty who delivered most of the content for In Focus 1 is Anita Mehrotra. Anita is a colleague of mine in nephrology. She's a KL2 scholar who's doing clinical and translational research in nephrology. So she's still currently a mentored clinical investigator, which I thought was a nice model for the students to see that even faculty members still require mentorship. And she also is not so far away from having learned the statistics that she has forgotten what it was like when she didn't know them. So we certainly have amazing statisticians here that could teach the material, but we weren't sure that those statisticians would really be able to relate to students, some of whom have absolutely no background in statistics. So she, I think, is really sort of a model educator. She's a very natural teacher and was great with the students, and we were really excited to have her on board. So again, she's teaching just the fundamental concepts of study design and in Focus 1, and I've listed some of the things here. So again, just basic ideas of epidemiology, disease prevalence, incidence, and outcomes, things that you might think you know, but when you actually, as we discovered when we tested them, many students who thought they knew this and took the exemption exam actually don't know these concepts well. They know the words, but don't really know the difference between prevalence and incidence. We talked about experimental study designs, ways to allocate patients. How do you randomize patients? Is it a convenient sample? How do you do this? We talked about observational study designs, subject selection and sampling, sources of bias in research, and also we had an external speaker come and give a talk about survey design. The reason that we did that is because we have really a ton of students who do research that are survey-based. And so we had somebody who's actually doing this in the field as a global health investigator, so it had some relevance both to the global health track and also to our students. Again, Anita was also the core lecturer for In Focus 2, and as I mentioned before, this really is sort of tackling the fundamental concepts of statistical comparison. So how do you compare two groups? How do you describe a group statistically? So she first started with this, again, with the basic scales of measurement, with what different types of data can you work with, and how do you work with those data differently? A difference between a measurement like age and a measurement like gender, for example. She talked about how data can be distributed, how to describe the center of data, and also how you describe the variability around that. She then introduced the concepts of statistical significance and confidence intervals, and then again taught basic univariate comparisons, chi-square tests, t-test, and then when you might not be able to use those traditional tests, what alternatives you had. And then finally, towards the end of this week, introduced the concepts of statistical power and sample size, which I think are really critical elements for designing a research project for the summer. So In Focus 3 is still a work in progress. We're starting to meet actively about this. And the proposed faculty for In Focus 3 and potentially for 4, Keith Siegel is also a KL2 scholar. He's further along in his training. He's just completing his PhD now. Actually, I'm on his thesis committee that's meeting fairly soon. So he is further along in this training, but is, again, still a clinical investigator, actively involved in doing his own work. He's got a fair amount of practical expertise in survival analysis. That's really been his primary area of interest. And at least at this point, he is as interested and I think is likely to be the lecturer for this. And again, that's going to be more advanced statistical concepts. And then we have Alan and Rachel here from the Levy Library, so really our collaborators in educating students in those areas. I think are going to be, we're going to work to develop the EBM portion of this module together. So again, this is going to be really just the principles of multivariate analysis. How do you adjust for potential confounders, and the principles of survival analysis, so that when a student looks at a Cox proportional hazards model, they at least have heard those words before and understand the limitations and strengths of that type of analysis. And finally, we'll do, I think, what is one of the sort of crowning features of this is really pointing out the bridge from research into clinical medicine with evidence-based medicine. To highlight really the overlap that exists between these two skill sets, and how understanding how to read a research paper is equally important for clinical medicine and for performing your own research. And we're planning to continue at least a journal club format during In Focus 4, although probably less in the form of formal didactics. There's also, as I mentioned before, just going to be some introduction to the responsible conduct of research, which I think is an important component of this. We can't just teach them the skills without at least bringing up some of the issues that arise. In Focus 2 this year discussed guidelines for authorship. We brought up briefly the concept of conflicts of interest, and all of our students this year were asked to complete the same faculty disclosure form that we all get on an annual basis. Part of the reason for that was just to sort of cement this concept, and part of it was a practical issue, which is that they all end up having to do it when they do their IRB. So we decided that having them do it shortly after the introduction of the concept of conflict of interest would actually point out that this is, this becomes part of your professional responsibility. In terms of human subjects protection, we did discuss some cases, but primarily they're training, again, for practical reasons. Our students, we've discovered, really do not like redundancy, even if one form of it's much more entertaining than the other. And all of the students have to complete the city training as part of their IRP application process. And so because they're getting the information there, we really just focused on some cases in terms of human subjects protection. So what are we going to do in the future? And some of this comes back to the challenges that I've talked about before. I mean, one of the things that we all know, and I think and learned more this year, was that our students, particularly in this generation, don't really love lectures, even when they like the lecture, and they certainly don't love formal lectures in a lecture hall. Interestingly, I think probably on an average day where there were 10 students in the lecture hall, I think the other 120 of them were at home watching them, because we got feedback, great feedback about Anita from everybody who watched at home in their pajamas. So students, I think, really enjoyed her lectures, and I think we'll keep those in some format, but I do think that we need to incorporate some more interactive sessions, whether those are small group or large group discussions. And I think one of the examples that we thought about last year would be a survey design workshop, which is something that I had wanted to talk to Rob about as well. We'd like to continue to integrate with other in-focus topics. So we did work together as a team with what we call the afternoon session. So this hardcore material we taught in the morning of in-focus, which worked out well, because when students found out that the lectures were optional in the fall, in the spring, they got to sleep in later, I guess. So. But the afternoon sessions were really, again, as I mentioned before, were other topics that we felt were essential for students to learn. So this was going to be HSRNJ, Human Rights, HRSJ. I was like, that didn't sound right. HRSJ in the fall was global health this spring, and last fall was the health disparities. We really tried to integrate with the topic that was being discussed in the afternoon. So if we were picking an article, we would try to pick an article that was relevant to the afternoon, where we could talk about the statistical methods in the morning. And we'll continue to try to do that. And I think one thing that we'd like to do this year, we just couldn't get our ducks in a row in time to do it this year. This year, we really only offered an exemption exam for students who thought that they could pass it. I would actually like to pre-test everyone next year, because I think it's really important and something that's not well described. Everybody knows that there's a huge spectrum of knowledge when students enter medical school, but it hasn't really been very well described, and certainly not in our schools. So I think a pre and post test, both to describe what comes in and also what the value is of this course, so that we can improve it over time. So I think I'll stop there, and we have a lot of people that we'd really like to acknowledge. Obviously, Alicia, who you met, I think if we were trying to do all this on our own, would probably no longer be standing. Grace obviously has been doing Research Day for many years and continues in that role. Megan, actually, I think probably Alicia would no longer be here if Megan weren't helping us to track the milestones. And again, our track advisors, and I should add to this Anita, because she really has been a really gracious educator for the didactic components, despite the fact that students don't really show up as well for lectures as some of us used to in the olden days. Really has been gracious, approachable, and really has put her heart and soul into teaching those courses. So I think we'll stop there and see if people have questions or suggestions.